Okay. Okay. I'm going to be talking to you today about understanding and identifying barriers and facilitators to implementation. Um, we've been talking about a little bit about models and frameworks. We did so much in much more detail in the first training. So if you missed that, I would encourage you to go back and to look at some of the resources. But one of the reasons that we talked about theories and frameworks is because they represent a way of understanding and identifying barriers and facilitators to implementation, which, why is that important to know? Well, it's important to know because of what Dr. Bala just talked about, how the focus of implementation science is on the development and use of strategies to increase implementation, to improve or accelerate implementation. And so it's essential to understand what barriers and facilitators there might be in order to develop those strategies. What I'm going to talk about today is explaining how barriers and facilitators can influence implementation a little bit, describe the process for identifying barriers and facilitators. I'm going to discuss how constructs from theories, models, and frameworks can help inform the identification of barriers and facilitators. And also, how to assess and prioritize those. We talked a little bit about assessment last time. Part of assessment has to do with asking the right questions and using mixed methods approaches. And this is something that we're going to be digging in a bit more with the groups that we're going to be working on as you develop your proposals. And we're going to also today walk through an example of chronic disease prevention and identifying those, what they did. And this was a study in Uganda to identify barriers and facilitators. So first, what is context? You hear that a lot. Context matters. Context is important. Everything happens within context. The various factors influencing implementation are often referred to as barriers and facilitators to implementation. But what do barriers and facilitators represent? They represent what's going on in that context. So context has been defined as a multidimensional construct, basically anything that's not the intervention itself or the outcome. It's all of everything in between that represents those things that are going to influence whether or not something is implemented or to what extent something is implemented. So when determining those contextual factors or those barriers and facilitators, you have to keep in mind the complexity of context, right? And one of the things is that context is multi-level. When we talk about context, we're often talking about other people engaged in the implementation effort. We're talking about the organization and the factors within the organization that can serve as barriers for facilitators, or the community, if it's a community intervention. We know that context is multi-level, that context can either help or hurt implementation. That context can change over time. We talked a little bit about disruption and displacement of individuals and how incredibly difficult that can make any implementation effort, and also how it can affect health in general and outcomes. And then contextual factors are different. Some of them are modifiable and others are not. And so this is something that as we talk about barriers and facilitators, as you think about, well, what are the barriers and facilitators within our context when we're thinking about what can influence implementation, either positively or negatively, it's also good to think about whether you think they're modifiable or not. Sometimes people think about, I'm going to address, or I'm going to identify barriers and facilitators because I want to change them. I want to develop strategies that are now going to influence those barriers and facilitators. Well, that can be true for some of them. Some of them may be able to be influenced, but some of them may not. But it's still good to know what they are, because from a research context, we call this a mediator, something that can be influenced through the implementation strategy, or a moderator, something that may not be able to be influenced, but we want to be able to measure it or account for it so that it can explain maybe why we didn't have an effect, or maybe why the effect was greater. So when and why should we consider context? The context in which interventions are implemented influences implementation. And so it's important to assess and report on contextual factors that could influence implementation. And this is important because it can help improve specific implementation efforts, and it also contributes to the knowledge that can be applied to other settings. So in implementation science, when we talk about contextual factors, a lot of times we're talking about them retrospectively. So something happened, you tried to implement something and it didn't go that well, or maybe it went well in some areas and it didn't go well in other areas, and you want to understand what happened. And the reason why it's good to look back sometimes is that if you can help determine what went wrong, then you can improve future efforts. And again, this is important not just as an sort of what's sometimes called operational research, but it can contribute to the development of implementation strategies in the future. And it also can contribute to our broader understanding of context. What is context and why does it matter? And then, of course, prospectively, it's important because if you're going to be developing strategies to influence implementation, you want to be able to identify those barriers and facilitators so that those strategies can address as many as possible. And your knowledge about those barriers and facilitators can influence your selection of strategies or your tailoring of those strategies. So when we consider context, you may be saying, well, how do we do this? How do we consider context? I have my ideas based on my experience, and our team has our ideas, but we may not be considering everything. We may be overemphasizing some things and underemphasizing others. So I'm going to talk about some of the ways that you can go about considering context, identifying those barriers and facilitators. One of the most critical things, and we're going to hear more about this from Dr. Bro, is involving key stakeholders and partners. I heard the other day, last week, that the term stakeholders is a term that is a little bit controversial, that it originates in and has some meanings related to colonization. And so we're trying to think about what are other terms that we can use. I'm interested to hear your thoughts about that term, whether you think that it's maybe not a good term to use, but I'm afraid that it's embedded within my language still and these slides. And so it's going to take a little bit of time to change that. So I hope that it's not offensive to anyone. But another term that we can sometimes use, I think, is interested parties, those people who are interested or have some interest in the implementation effort. So the critical piece here, though, is making sure that you involve those people who have some role or care about or could influence that implementation effort, because they can help identify and prioritize those most important conceptual factors that may help or hinder implementation. We also want to combine quantitative and qualitative data. This is called mixed methods approaches. We talked about it a little bit last time. And these these approaches can help obtain a comprehensive and in-depth understanding of contextual factors influencing implementation. And in a minute, I'm going to talk about these core processes for incorporating theory, experience, community feedback, and new data to gain a better understanding of all of these factors influencing implementation. I'm not going to talk about this too much today, but I'm going to mention it. And I believe that Dr. Smith is also going to mention the use of implementation research logic models. The use of logic models, which are essentially what affects what, the logic of what is influencing what, can help illustrate how various factors influence implementation outcomes. So I'm going to just talk to you just a little bit about this case study that if you are able to get the book on practical implementation science, it's described there. The United States Veterans Health Administration is an organization that really is responsible for the health care of veterans in the United States. Veterans are people who have served in our country's military, and it actually is a health system in and of itself. And in some ways, it's a health system that is more similar to other health systems in other countries, because the United States has a very fragmented health system where we have private care, we have public care. It's unfortunately highly fragmented and not organized. But the Veterans Administration, one of the advantages of it is that it is a centralized healthcare system. And as such, it's been an excellent laboratory, so to speak, of implementation science. And Dr. Damschroeder, who is the developer of the CFIR that we've talked about a lot, has been working in the Veterans Administration for many years. And this was a study that they conducted. It was a 2-year pilot to implement an evidence-based program called the Telephone Lifestyle Coaching Program with 25 medical centers across the country. And in this program, the TLC, we'll call it the TLC program, provided telephone-based counseling, coaching to help patients enact healthier behaviors, so healthy weight, smoking cessation. And medical centers had to identify patients who would benefit from this telephone coaching program, and then the referral, the patient would get a referral, and when the referral was received, a coach would call the patient and orient them to this program, and then provide up to 9 coaching sessions over the span of 6 months. This was an evidence-based program. We've been talking a lot about evidence-based interventions, evidence-based programs. The TLC was an evidence-based program that now they were trying to implement across these health centers in the United States. By the end of 19 months, about over 9,000 patients had been referred to the TLC program. But there was a significant variation in the rate of referral that was observed across these 25 medical centers. The centers with the highest referrals had 7 times more referrals than the centers with the lowest rate of referral. So huge differences across these same types of medical centers. And so the guiding questions for identifying the barriers and facilitators of implementation of the TLC were basically what factors contributed to these large differences in referral rates. And so to better understand what happened and identify the barriers and facilitators, a team of researchers partnered with policy leaders at the Veterans Administration to help evaluate these experiences. And they participated, clinicians and staff from these health centers participated in this pilot study. And the respondents cited numerous challenges of about program delivery. So they weren't talking about effectiveness. The program was effective, but it was the delivery that was challenging for some of the health centers. And these included things like the team noted that the medical center context was largely responsible. And they used, I'll tell you a little bit about what they found, but they used the consolidated framework for implementation research, right, to try to understand these contextual factors. So I'm gonna go into the kind of the process for doing this more generally, but I wanted to give you this case study, and here is the reference for the case study. But one of the things that they found were there were various constructs within CFIR that influenced implementation. But the main point that I wanted to make with this case study was that the CFIR was used to guide the identification of these barriers and facilitators and try to understand what some of the differences were. So what they did was they used this table here where they would identify these various constructs. And I know it's a little bit difficult to see, but along the left here, you could see various constructs related to CFIR. And yesterday we reminded you about the domains of CFIR that include things like characteristics of the intervention, the outer setting domains, inner setting domains, process domains. And so they were able to consider across different facilities. At the top, you see that there's different facilities, what the relation was between the referral rates and these various constructs. So this was all qualitative data, but it was qualitative data that was coded in a way that you could attach, like this was a positive thing, this was a negative thing, and also look across facilities to try to get some understanding. And here they sort of quantified that qualitative data, but it could also be done more descriptively, where you might have quotes or notes in something like this to summarize the data. But essentially what they found was that some of the things that influenced implementation success included strong implementation leaders, effective strategies to engage stakeholders. There are characteristics of the organization that influenced it, networks and communication, so strong relationships between implementation leaders and primary care leaders, and then the perceptions of compatibility of the TLC program with existing programs, and then also access to electronic health records. So I wanted to highlight this example, and I'm going to do another one, although I think that I don't have that much time left to go into detail about the other, but I wanted to give you some concrete examples. Now I'm going to go back more generally to the process. And I wanted to highlight that this book that we've mentioned, Practical Implementation Science, Moving Evidence into Action, I think has many chapters that are really helpful. The chapter that is specifically about understanding barriers and facilitators to implementation is chapter 5. And some of the things that I'm going to be talking about now are included, including that example that I just showed, are included in this chapter 5. So one of the things I wanted to talk about is these core processes for identifying barriers and facilitators of implementation. And these by no means are sort of required. I mean, these are things that we recommend. And when we look at the really successful efforts in trying to understand barriers and facilitators and trying to develop strategies to influence implementation based on barriers and facilitators, we see that people are following these processes. These processes are taken, are adapted from processes that we use for planning interventions. And those of you who are familiar with or have experience with planning interventions you may recognize these. These are ones that are similar to ones that we use in intervention mapping when we're planning an intervention. But essentially, they are just a set of helpful tools that can provide a systematic way of identifying potential barriers and facilitators. So community engagement is something that should be integrated throughout these main core processes. And they include brainstorming, potential barriers and facilitators. And this is based on your past need, your experience, your needs assessment that you may have done, the published literature that looks at barriers and facilitators for implementation, the use of theories and frameworks. You've heard this a lot from us. We've emphasized how this can be helpful. The collection of new data, like you saw in the example that I just showed, where they did interviews and with these people doing the implementation, and prioritization, right? So you're going to gather all of this data and then you're going to prioritize. So I'm going to step through each of these. Sidra, can you remind me how much time I have left? I lost track of the timing.
Sure, we have about 7 more minutes scheduled.
Okay. So that's quite I think I spent a little bit more time on that case study than I had intended. I apologize for that. I'm going to go through these a bit quickly, and then I won't say too much about the example, but luckily the example at the end is a published study, really beautiful study from Uganda. And so I encourage you to read that article. So core processes, the number one is brainstorming potential barriers and facilitators. Now, this is I don't know how often you do this activity of brainstorming, but brainstorming, typically you have your group together, your planning team that hopefully includes interested parties and implementers, and you just talk about anything. You want to answer the question, what could influence implementation if it's in the future, or what has influenced implementation if it's in the past? And you just put every idea that you could imagine. And then you go back after the brainstorming and say, well, is this one important? Maybe not. And you contextualize it. But this is an important activity because it considers and integrates the hands-on experience of various stakeholders. And it can help if you're also, as researchers, bringing to the table what you've seen from literature, what you may have ideas about based on your own experience. It can help align or determine the alignment between practitioner experience and published evidence. And sometimes that can go either way. Sometimes it can broaden and it can help people that have practical experience realize that, oh yes, that is something, in fact, that we hadn't considered, but now that you talk about it, it's something you're bringing from the literature. Yes, that does seem like something that was relevant, but it also can help the practitioner experience maybe negate some of the things that you brought from the literature, and realize that actually wasn't something that was important here. Core process 2 is using theories, models, and frameworks to identify barriers and facilitators. We talked a couple times, so I won't go over this, about why it may be useful to use theories, models, and frameworks. And we also talked about the different types of theories, models, and frameworks that they are. For this piece of implementation science, it's this middle group. So understanding those frameworks that are used for understanding and explaining what influences implementation. This is a great resource from the Washington University in St. Louis that can give you an overview of some theories and frameworks. It has live links to, for example, the CFIR. We've been talking about the CFIR a lot. And it also explains the various different theories and frameworks. So I encourage you to look at that. When we talk about determinants models, right, that's these. These can be helpful for understanding why things happen, helping predict what might happen in implementation, and also to inform the selection or development of implementation strategies. We talked a little bit about, yes, these are theories and frameworks, and several of them, the majority of them have been developed, in high-income countries. And so the question is, how relevant or useful are these in low or middle-income countries? And there's been some studies that have specifically looked at that, but I think that it's a critical piece of research that needs to be done. And you all are well positioned to start asking these questions and contribute to the literature, contribute to the further development of these theories. And I believe that Dr. Gang mentioned this yesterday, that there's a great example that where they looked at CFIR and how it had been applied in low and middle income contexts. And there was a recent review, and they identified actually new domain that they added to CFIR called characteristics of systems, and how this can influence implementation. Another core process is collecting new data on barriers and facilitators. And this can be challenging because, as we mentioned, it's a multi-dimensional and multi-level context that we're trying to gather data on. And so we recommend that you use mixed methods to do this. As I mentioned, the assessment can occur before implementation begins, throughout the implementation process, or after implementation has happened. And complementing the data through surveys, interviews, and observations with community feedback is really important to get a complete picture of what happened or what could happen in implementation. And then we go to a process of prioritizing. So hopefully, based on your look at theory, your collection of new data, your brainstorming from experiences and the literature, you have a large group of barriers and facilitators to implementation, and then you're going to want to prioritize them. Sometimes when you're trying to understand them for the development or selection of implementation strategies, you might want to think about how important these are and how changeable they are. How likely are they to influence, how likely are they to be influenced by whatever strategy we put into place? And if you're selecting or prioritizing barriers and facilitators for that purpose, for the selection or development of strategies, priority should be given to those factors that are both easier to change or possible to change and important. Those that are more difficult to change and extremely important should also be prioritized, right? So sometimes you can say, well, there's leadership engagement, that's a little bit more difficult to change, but it's very, very important for implementation to be successful. Then those should be prioritized when you think about your implementation strategy. And then also those things that are easy to change, but if we change them, it's not necessarily going to have that much of an impact. You still might want to influence those. And sometimes these are things that are required because, like knowledge is pretty easy to change. And it may not, whether or not somebody knows about an implementation effort or not, might not in and of itself influence implementation, but it's sort of a required precursor. And then obviously factors that have a low impact and are difficult to change should not be given priority. We use things like this to help organize whether or not it should be a priority, where you can rate its importance and changeability and write notes or provide evidence for its importance and changeability. I'm not going to talk about this because I think I'm out of time here, and I'm going to talk about implementation mapping and just a little bit. But even though the main point is, even though we use implementation mapping to plan implementation strategies, it can also be used to organize what you think is influencing implementation. And that's also true for the implementation research logic model. So this is the example that I was going to go over, but I'm out of time now, and I want to make sure we have at least a few minutes to address your questions. But I really encourage you to, and you'll have these slides as well. I encourage you to read this really nice study on barriers and facilitators of implementation of community cardiovascular disease prevention program in Uganda, where they used the consolidated framework for implementation research to understand some of the factors that were influencing implementation. They came up with this really nice visual where they had pluses and minuses. If it was a plus, if it influenced intervention adoption, it was a negative if it hurt implementation adoption. And in some cases, it was both a positive and a negative. And these data were obtained through talking. It was the community health worker delivered intervention. So from doing interviews with community health workers related to their experience. So I think this is a really nice example. I'm going to wrap this up. Common pitfalls or common difficulties include when people start looking at these complex models of implementation science. They sometimes become paralyzed by the wide range of choices of models. Our suggestion is to narrow down those frameworks or the ones that are of most interest to you. These are things that and you think are most relevant to you. These are things that we're going to be working with as part of the technical assistance that we're going to be providing the groups as they develop their strategies. And also when thinking about context, sometimes another problem is that implementers often think about the broad organizational factors that could be influencing implementation, which of course is very important. And they forget to think about the team and individual factors, which are also very important. So I'll leave it there. I think that the core processes that I talked about can be really useful as you identify these barriers and facilitators, but really there's no one correct way to do it. These are just ways of trying to make sure that you get as much information as possible so that it can inform your efforts and it can inform your development and selection of implementation strategies moving forward. Thank you.